Good afternoon, everyone. It's Friday, the 8th of January, and welcome to the first Oxwide of 2021. We're going to be focusing today on COVID, unashamedly so, because I think it's probably front and centre of all of our professional and personal lives at the minute. So I'll just say a few bits about what we know is happening with the virus at the minute, and then Iain Dimond is here, and he's, of course, our Chief Operating Officer and also gold for the management of the COVID incident. Iain's going to be telling us a bit about how the Trust is responding and where the pressures are right now. We've also got a film about vaccinations as well, and of course that is the hope on the horizon that we have right now. So with COVID, we're in a position where we're now in our sort of second official lockdown, but it's the third lockdown really, isn't it, if you count the one in November and so on. And the decision was taken was at the start of this week, blimey, it feels longer than that, but the decision was taken to put us into a full lockdown again in response to the rapid spread of COVID in the last couple of weeks. And what we've seen is that this new variant of COVID, a form of the virus that has changed slightly, appears to be much more infectious. And there's a couple of printed evidence-based articles now which do seem to prove this is the case. And as a result, there's been a real surge in cases. And we've seen across our parts of southeast London, the places where many of us live in London and in Kent and so on, we've seen the numbers coming back really quite relentlessly in recent weeks. And I know in Greenwich, I think today it's over 1,000 per 100,000 members of the public. I think 1 in 3 people who have been tested in Greenwich Borough today is testing positive for COVID as well. So it really is everywhere. And it certainly feels to me, it might do with you as well, as though most families I know, most people I now know have been affected with it within their family, whereas this certainly wasn't the case last year, but it feels as though it's much, much closer to everybody this time. And on top of the hard work we've been putting in, it makes it quite a hard time. But what we're seeing now then is this lockdown's been put in to try to deal with that. And the people who are being admitted to hospital at the minute, and there's a higher number of admissions. I mean, I've just been on a call, and the chief exec of one of the large London trusts was saying they've got a third more people with COVID now in their beds than they had in the first wave last year. So this is really, really very high pressure. And the mayor's just declared, from a City Hall perspective, a major incident. We're seeing these numbers coming through now of people who would have been affected in the run up to Christmas and around Christmas and between Christmas and New Year. We're then going to see that pressure stay on the NHS for another couple of weeks until the impact of the lockdown really starts to hit home. So I think what we're in a position at the minute where it's kind of buckle your seatbelts, and we have 2 to 3 weeks of very, very difficult work ahead of us. I think it is harder than anything we went through last year. I think the fatigue in the system, the fact that we're dealing with other conditions as well, we haven't cancelled everything else in the way we did last time to avoid that harm, but it means we're in for a very stiff January at the minute. But I suppose on the positive side, there's been Pfizer published a report today saying that their vaccine does work against this variant and against the South African variant. I haven't read that yet, but it's been reported in reputable places that this is the case. So this, in many ways, may well be the last really big hard push before we get into an era where actually we can see more and more people being vaccinated. And if you look at the way they're prioritising the vaccines, 2 things I'll just say before we bring in Iain. One is that there's a good evidence base for making the decision about giving 1 dose of the vaccine and then the second one 12 weeks later. And what I'll do is actually I'm going to ask Steve Cooksley to put on the Ox the links to the papers that show the evidence for this. So there is a decent evidence base to say more people with 89-90% protection is better than a smaller number with 95% protection. And the fact that we're doing this means we can get healthcare workers vaccinated. And the other thing about it is also 88% of the COVID deaths we've had so far have been in the people who are in the priority groups that we want to get vaccinated within the next 5 weeks. So if we can get these priority groups, the care home workers, the care home residents, the people who are highly vulnerable, if we can get them vaccinated, that would be 9 out of 10 of the COVID deaths we've seen so far. That would be those people offered a strong measure of protection against the virus. So we are into this real hard push now, but there is some real positives in sight here. So what we'll talk about now with Iain, though, is how it feels in the trust right now and the kind of things we're trying to do to get through this real push over the weeks ahead. So Iain, welcome. And so it's feeling pretty tight and pretty tough out there right now, isn't it?
Yeah, thank you, Matthew. Yes, I think challenging is the word that I would use. It feels as though we're revisiting the situation we found ourselves in at the beginning of the first wave of the pandemic. And I think the added pressures of winter that you normally see are really kind of contributing to stress that I know colleagues are feeling at the moment.
And Ian, in terms of what we're seeing operationally, and I mean, what's happening with staffing just now? Because that was a big problem for us, wasn't it, last April, May? The high rates of staff absence.
Yeah. So certainly since Christmas, I think the number of COVID-related staff absences has been on the increase. It's certainly not at the level it was back in March and April, but certainly as of today, I would say about 4% of our workforce overall is off with some kind of COVID-related absence. So we're reporting about 129, 130 people absent. And it's not evenly spread, though, across the organisation. So I think it's leading to some particular challenges in certain areas.
And we're seeing a lot in the papers about the pressure on the ambulance service, the pressure in acute physical health hospitals, ICUs, etc. Where are we really feeling the pressure just now?
So I would say that in response to the pressures in the acute sector, we've had to really think about what we offer in terms of helping them out. So that's our colleagues at the QE, Darren Fowley, and at the Crew. So very quickly, we've had to change the way that we're running our adult community services. So that's everything from district nursing through to our intermediate care beds. We very rapidly mobilised business continuity plans, prioritised the services that are going to have the most impact, and then alleviating those pressures. And inevitably, because that work is face-to-face with patients, it's leading to a kind of higher rate of kind of COVID-related absences. So as of today, I think where we're really feeling it is in our district nursing services, but also in our inpatient services, and that is both physical health and mental health.
I think it's interesting for the press. The most visible part of this pandemic is the ambulances queuing up. You know, I've seen on the news the ambulances outside Darrant Valley and outside Medway and places like that, and similar in South East London. But our district nurses and intermediate care teams are doing some really tremendous work, aren't they? Both to take people out of those hospitals, stop them going in the first place, and also to keep some very sick people as well as they can be at home, aren't they? And that is really important. We don't lose sight of the pressures on them, isn't it?
No, absolutely. I mean, I can't thank staff working in those areas enough. Really, it's the pressure they're experiencing is immense, and unfortunately, as you said at the beginning, I think those pressures are going to be around certainly for the next few weeks. We are doing everything we can to try and ensure that we have the correct levels of staffing and that services are safe. And certainly from a Gold Command perspective, which we're monitoring that on a daily basis, and I'm in close touch with the Directorate Management team.
Okay. And mental health wise at the minute, I know we've been doing a good job over the last couple of weeks to try to keep the long delays for admission as low as possible to really manage that. I suspect, though, as with the first wave, what we might be hit with is after the lockdown is lifted, we might start to see that really big wave coming through then again. So, I mean, inpatient services, how are they looking, and what are we hearing from our community teams just now, community mental health teams?
Yeah, I mean, it's interesting what you say about lockdown and whether that will influence our patients' behaviour, because certainly, as you say, in the first wave, it really reduced the number of people attending ED. Up until the announcement last weekend, we were still seeing quite a number of people presenting at ED. I expect that has dropped off a little bit, but not quite to the extent we saw last March and April. So admissions have been steady. However, we've been managing the situation extremely well. The number of delays in ED haven't been particularly high. And we've been managing to create capacity both within our own beds, but also in the beds that we contract from the Priory in Roehampton. I think the one thing I would say, though, is that the rate of spread of the infection amongst the inpatient group is starting to increase. So there are a couple of wards where we've had to close for admission just because the rate of increase has been quite steep this week. One of those being Holbrook, which is obviously looking after a very vulnerable group of older adults. So we really need to make sure that we're protecting them. But we're keeping the situation under kind of review, and at the moment we're not contemplating moving to a cohorting scenario, but that's something that we might have to think about in the next few weeks.
Yeah, and I mean, we'll have to keep an eye on that, as you say, because I know there are a number of other London trusts who've now had to sort of start with admission wards, and they're holding people there until they get 2 negative tests before they can admit them on, and it creates some real bottlenecks, I know, and some real pressures. And we've talked a lot about the sort of physical health and mental health needs of our patients. I mean, what about our staff as well? Because this is a tough old period for us all, isn't it? I mean, we didn't really have the Christmas and New Year we wanted. We've come back really into the thick of it right now. So is Gold in the ICC, we're talking there about what we can do to support our staff, aren't we, as well as what we can do to keep services going?
Yeah, I mean, I think it's a real balancing act, and it's a conversation we need to keep open with all colleagues, really. I know that other organisations have taken the step of cancelling leave just because their staffing challenges have been so high. That's not something that we've considered up to this point, and for all the reasons that you said, Matthew, it's not something that we would enter into lightly, because people need a break. This feels really, really exhausting. We're all feeling very, very tired. So we're going to keep that under review. Where people can take breaks, I would really encourage them to take leave. But it's difficult, isn't it, in the context of lockdown? And I know for a number of our staff, they're also having to adjust to having their children at home because they're not at school. I'm sure that's something that you can appreciate, Matthew, yourself. So there's a number of competing pressures on people's times. I would be very open to having more conversations to understand whether there's anything more that we can be doing. We're certainly giving a lot of thought around well-being and anything we can do to lift people's spirits. But we want it to be meaningful. We don't want to just do something that feels a bit gimmicky.
Yeah, sure. And I know we've had some exec listening sessions. In fact, I was due to join one yesterday, but due to the challenges of balancing homeschooling and work, I had to give my apologies for that. It is tough doing some of this stuff, isn't it? It's tough trying to keep all these balls in the air. So I think it's important that people are checking in on each other. I think, that we're looking out for each other, and that when we have ideas about things we can do to make a difference, that we do let people know. And I suppose one of the real positives that we've got coming down the track is the fact that, we will very shortly be starting to vaccinate people as well. And that's something that the Incident Control Centre has been looking at, Iain, isn't it? This is something that can offer some real positive news in the immediate horizon.
Yeah, no, I think this will be a real game changer, actually. I mean, our hope is that we will have supplies of the vaccine next week. We're certainly doing all the preparatory work that we need to do to set up vaccination sites at Queen Mary's. We've got a list of staff that we can call upon to administer the vaccine. So I think we're pretty much there in terms of being ready. It's just about getting hold of the vaccine itself now. But I'm confident we will have it next week.
That's great. Then I think we now, in fact, have an interview, don't we, with Jane Wells, Paul Maycock, and a couple of colleagues about the vaccine. So I'll come back after this film, but there is, as I say, some really good news on the very immediate horizon around Oxleas staff and their access to vaccination. So with thanks very much to Iain and to all the staff who are really helping us hold it together through this very tough incident. Couple of tough weeks ahead of us. But as you'll hear from this film about the vaccine, there's some very positive light at the end of the tunnel, and the good news starts pretty soon. So over to the film. Thank you.
Hello, my name's Sally Bryden, and today I'm joined by Jane Wells, Director of Nursing, and Chief Pharmacist Paul Maycock. It's really exciting news that we're planning to start vaccinating our staff from next week, and I know staff have got many questions about what this means for you. So therefore today we're going to try and answer some of those questions. But the questions we can't answer today, we'll try to answer through a question and answer sheet that we'll publish through the internet, the Ox. So Jane, to start off, can you tell us a little bit more about the vaccination centres that we're setting up? What's involved?
Well, thank you, Sally. Yes, we're setting up a site at the Queen Mary's Hospital, and we've decided to set it up on one site because we can't actually transport the vaccines to different sites at the moment. So we will be using the building as you go in through the main entrance of Queen Mary's. It's on the left, no, the right, the first car park, the old A&E. And that's where we will be able to run our clinic, where we hope to be giving 4 vaccinators running the clinic simultaneously. We should be starting to operate next week. We are waiting on the confirmation of the day, which is really down to when we'll get our first delivery. But we're all set to go. The site is ready, the staff are ready, the computers are ready, and the equipment's ready. So we're really excited that we'll be able to offer this to our staff.
So is the vaccination programme open to all members of staff, Jane?
Sally, it will be. The Joint Commission for Vaccinations and Immunisations has put health and social care staff in their top 2 priorities, along with the 80-year-olds and the care homes. So we will focus on inviting our clinically extremely vulnerable and those in at-risk groups at first, but it is open to all staff. And staff will be able to book an appointment, so they won't have to come and queue. They'll have a time and they'll be able to do their screening questions in advance. So yes.
Great, that sounds great. And do we know yet which vaccine we'll be giving out?
We know it'll be one of the 2, the Pfizer or the AstraZeneca, but we don't know yet which one will be allocated. And that's really down to national supply. So it could be either, but they're both very good, both effective. So, and we're trained to give both, so it really doesn't matter.
Oh, that's great. So what sort of preparation have we taken, Paul? Obviously, there's lots of guidance that has had to be looked at. Can you give us a bit of background on that?
Yeah, thanks, Sally. There's been a lot of national support, obviously, for this programme, and a lot of things have been produced nationally to support those like us rolling out this programme. So we've been supplied with SOPs for each of those vaccines that we can follow, as well as information. And there's also a whole batch of leaflets and other resources available, which we'll hopefully make available through the intranet for colleagues to look at.
That's great. And we've had quite a few questions coming in from staff about that kind of where to get more information. Some members of staff have mentioned that they've got allergies, or they're thinking of starting a family or maybe pregnant, and they want to get advice about whether the vaccination's for them. How would you advise them?
I think the first thing to do would be to look at the information that we'll make available and is available to anyone on the internet, on the .gov site, and see if that answers their question initially. And then obviously for anyone with any further questions, they can obviously discuss that with the clinician when they attend for their appointment. Great.
And the people, some staff have asked questions about that they've had COVID, or they're actually experiencing COVID at the moment, and they're not sure whether they can still have the vaccination. How about that group of people?
So those that have had COVID infection previously can still be vaccinated, and the nursing team working under the patient group directions that have been provided nationally, it does allow for this. The only exception is those staff that have had COVID vaccination in the very short term. They suggest waiting at least 4 weeks after you've had symptoms or since you had your positive result, just to make sure that the infection has passed. So when we have the vaccine, we can just differentiate between any side effects potentially of the vaccine or have still got issues with the COVID infection.
That's sensible, thanks. Jane, some of our members of staff have asked about how they get the vaccination and whether they can have an opportunity to have it later in the year.
That's a really good question, Sally. At the moment, we've been asked to run sessions to try and get as many staff vaccinated, at least with their first dose, within the next few weeks. So we know there will be a supply of vaccinations for our staff to initially have the vaccine and to get their second dose, which will be up to 12 weeks later. What we don't know yet is what will happen to anybody who didn't have the vaccination within that time period from Oxleas. That said, the vaccination will still be available from GPs, from pharmacists and from mass vaccination sites. So although we don't know whether we'll be providing it still in 6 months' time through this setup that we're running now, I'm pretty confident it will still be available for people. And we do understand it may take a few people a little bit longer to make a decision about whether they want to have it or not. So we'll support people to try and get it if they don't have it at the moment, but I would really encourage people to try and have it now.
So, Jane, for our staff who are working with patients, what difference will the vaccination make for them?
That's another really good question. What it will do is it will protect workers at higher risk, especially those working with vulnerable people. But what doesn't change is the hands, face and space. Everybody will be expected to adhere to existing PPE guidance and national rules and regulations around this. It's really important that people remember to do that. And by having the vaccination, we're all contributing to, the goal of trying to get back to normal, but it's really important that we remember there are infection prevention and control measures that need to be followed still.
That's a really important message. Thanks, Jane. And for colleagues, one colleague's mentioned about can they choose what vaccine they have? How are we able to offer choice, Jane?
We're only able to offer the vaccine that we're provided with. Whilst we can express a choice about what we might want to order, we really are down to the mercy of the regional supplies that are available. But as I said previously, they're both very effective and we're trained to give both. And we would encourage people to come forward and have whatever vaccine that we have available.
Thank you. And finally, Jane, how will people be able to book their appointments? And can people just turn up at the vaccination centre to get a vaccination?
People can't just turn up. When we know when the vaccines are being delivered, we will release a booking system. And this is very similar to the lateral flow system for people who are using that. People will need to register on the system. They'll need their NHS number. It's very quick. We'll provide some guidance so that people can book onto the system. And then they'll be able to book onto a specific day and time slot for them to come and have their vaccination. And this is really important because people need to make sure that they're social distancing, so we don't want people queuing. We only want the right number of people in the clinic at the right time, and people have to wait for 15 minutes afterwards. So it's really important that people stick to the allocated slots and do book in advance, please.
Thank you very much, Jane and Paul. That's been really helpful. And I know we won't have answered all the questions that staff have got because it's new for all of us, but we will be putting together question and answer sheets and creating a page on the Ox, our intranet, where we've got connections to all the sources of information, and we'll give updates as well, including the booking system as soon as that is available. Thank you very much. And now I'll hand over to Matthew.
Welcome back, everyone. I hope you found that film informative and useful. And, really, we couldn't be more grateful for the work of the many scientists and others across the country who made these vaccines possible. I think if we were going through this without that on the horizon, it'd be a very different prospect. So great news. And as soon as we have the information on how you book yourselves on and how we are rolling it out through SIDCUP and elsewhere across South East London, that'll be available on the Ox. So do keep an eye out on that. So today then, I don't want to say too much more today, really. What I would like to say is just make sure you're looking after yourself. This is hard yards now. This is really into the thick of it, and it's not a normal winter, is it? It's exceptionally tough. We're dealing with winter, we're dealing with COVID, we're dealing with the fact that none of us has really had a particularly good break for some time now, and we're also looking like things like the vaccination programme and how we staff and resource that, and how we make sure we can do all these different things together, you know. And unlike the first wave, where it was very much we've got COVID to worry about and very little else, now we're trying to manage that on top of all the usual winter pressures and others. And I know that's hugely demanding. And we're tremendously grateful for the efforts you're making. This is not easy. These are hard days to get through. So make sure you're taking some time out and looking after yourself. The way I'm approaching it, I'm thinking about what I'm doing today. I'm thinking about what I'm doing tomorrow, and I'm thinking about what I'm going to do in a few months' time, perhaps once we've been vaccinated and the weather's better, and I might get a day at the seaside and some fish and chips on the seafront at Hastings. So I think, you know, keep your focus close and keep your focus on the positive times that will come ahead, and try not to worry too much about what happens in between, and we'll get through this working together in the way that we always do. It's a time where I think we can all be proud that we're part of the NHS. The service is saving lives day in, day out. You're all saving lives day in, day out by the efforts you make. And at some point, we'll be able to look back on this and reflect on having worked our way through something that, you know, no one else alive has worked their way through a pandemic. You know, this for our generation is going to be a really sort of seismic moment. And the care that we deliver and the efforts that we go to are making a profound difference to the lives of ourselves, to those of our families, to the people we're caring for, and actually to our children who are growing up through this and who are going to remember this through their lives as something really quite exceptional. So thank you, all of you. Do look after yourselves, look after one another. If you're able to get a break over the weekend, do have one. If you're working over the weekend, thank you very much, and make sure you get some time off next week. And we'll see you all soon, but keep an eye out for that news on the vaccines, because that's coming our way very shortly, and it's great to have that very much in our foreground as we enter the couple of difficult weeks we've got ahead of us. Thank you, everyone. I'll speak to you soon.